Howdy guys, we're back to go over just one more of the course subjects that we'll be going over. We'll be talking about the neurocognitive and behavioral disorders. Now, in my daily work, I get consulted for people that have a change in mental status. What that means in the everyday terms is that somebody got confused, somebody was having some difficulty getting their words out, or somebody was having difficulty understanding what was going on. Perhaps they were not even responsive. This is daily work for me. And so we'll be dealing with these neurocognitive disorders. Some of them happen abruptly, some of them happen over a long period of time. We'll be coming to understand those, and we'll be talking about those in the neurocognitive and behavioral neurology section. So what we'll be dealing with are the dementias. And when we talk about the dementias, we'll be talking about those that involve the cortex, the outer covering of the brain. We'll talk about those that involve the subcortex. Of course, the outermost, the cortex, those are Alzheimer's type and frontal temporal cortex. When we talk about the subcortical dementias, we'll generally be referring to those like multiple system atrophy, diffuse Lewy body dementia. We'll talk about olivopontocerebellar atrophy. We'll talk about progressive supranuclear palsy. We'll talk about normal pressure hydrocephalus. We'll talk about all of the subcortical dementias. Aside from the dementias, we'll move on to the deliriums. We'll talk about delirium. Certainly it's a more acute issue where we can have some psychosis, a lot more abrupt, a lot more fluctuating in its presentation. Then we'll talk about the encephalopathies and the multiple causes of encephalopathies. We'll talk about the differences between delirium and encephalopathy. Some people say there's no difference actually. Probably psychiatrists practice in this manner, they're of this opinion, but neurologists typically see people in the hospital and see it a little bit differently. So we'll be distinguishing delirium and encephalopathy. And then we'll talk about the disconnection syndromes, those syndromes that occur when there's a lesion in the corpus callosum, a piece of anatomy that's right in the middle of the brain and has a lot to do with connecting one side to the other and enables us to be able to coordinate both sides. So those are the topics we'll be talking about in generally that order: the dementias, the deliriums, encephalopathy, and the disconnection syndromes. Hang in there, we're moving right along. Of course, this is just an orientation to the art of neurology. Keep winning, guys.